Thank you, Diane. I'm pleased to be here today to talk about what's in this year's report and also, more importantly, what's not. This report offers a snapshot of each state's air quality. It looks at levels of particle pollution and ozone, also known as soot and smog, based on data collected at official monitoring sites gathered across our state. Here in Maine, we monitor air quality in 12 of our 16 counties. The good news for Maine is that grades for particle pollution remained relatively strong. In fact, Bangor was ranked the 21st cleanest city in the nation for short-term particle pollution. These grades, though, for particle pollution don't tell the whole story. As anyone who has had their home filled with a neighbor's wood smoke can tell you, particle pollution can be a very local concern and never show up on one of these few monitors that we have. Our ozone levels improved by 1 or 2 grades in every county. While that's a positive trend overall, the grades are still low in several counties. York and Hancock both received D grades, while Cumberland and Knox both received a C. This year, 4 counties received Bs: Androscoggin, Kennebec, Penobscot, and Washington, and 3 actually received A grades: Aroostook, Oxford, and Saginaw. These results are all based on current EPA health standards, and unfortunately, that's where the good news ends. That's because the EPA standards do not represent the best science and allow for too much pollution in the air before alerting the public. EPA's own scientific advisory panel recommended stricter standards, but politics came before people, and the industrial polluters won. Does it make a difference? The chart on my left tells us yes, it makes a tremendous difference, especially here in Maine. Here you can see that over the last 4 years, based on EPA ozone standards used in our report, Maine has experienced 18 unhealthy air days. But when we apply the recommended science-based air quality standard, Maine actually had 101 unhealthy air days. The pattern over the years is consistent. Using the science-based standards, there were 7 times more unhealthy air days last summer than reported. This means on 6 of the 7 unhealthy air days that we had, no health alerts were issued. Over the 4-year period, there were an average of 5 times as many unhealthy air days as reported. This means on 4 of every 5 unhealthy air days, children, parents, people with chronic lung disease and chronic heart disease were unaware of the danger. That's unfair and simply unacceptable. It's a simple fact that when you can't breathe, nothing else matters. Maine's air quality affects our health, our ability to work, and our opportunities for recreation. Unhealthy air costs us millions of dollars annually in avoidable health care costs that are paid by individuals, the government, and businesses. Maine, more than any other state, needs a strong federal law to reduce pollution rolling into Maine. The Federal Clean Air Act is that law and has worked effectively for over 40 years. Yet in the past year, we've seen unprecedented attacks on the Clean Air Act and the EPA's ability to enforce it. Instead of protecting health of children and adults, members of Congress have been protecting polluters by advancing bills that would delay or undermine healthy air standards. Senators Snowe and Collins have figured prominently in these debates, and their support is critical to protecting the Clean Air Act and Maine's air quality. Air pollution isn't a Democratic issue. It isn't a Republican issue. In this state, you have to say it isn't an independent issue. But it's a regional issue, and it's going to take the leadership of Senators Snowe and Collins to ensure that the people in the Northeast don't pay the price while out-of-state factories and power plants earn a profit at the expense of our health. This contrast in EPA standards and science-based standards for unhealthy air days should serve as a wake-up call. We need to get involved and take a stand. We need standards that protect our health and not give us a false sense of security. We need a strong Clean Air Act and EPA air quality standards that put people before politics. I'd now like to introduce Ron Russell, who will share his family's personal struggle with COPD and cardiovascular disease and how that relates to healthy air. Thank you.